Hello, I am Dr. Mohan Raut. I am a practicing gynecologist and clinical reproductive immunologist. We have our centers, Dr. Raut Centers for Reproductive Immunology in Mumbai, Pune, Nagpur, Delhi, Hyderabad, and Bangalore. And at these centers, we treat couples with unexplained repeated miscarriages, recurrent IVF failures, and unexplained infertility using active immunomodulatory treatment of lymphocyte immunization therapy or ImmuLIT and other immunomodulatory treatments. Today I am going to talk about one interesting and important subject, and that is, can lymphocytes from a donor be used for lymphocyte immunization therapy? Now, all of you know that lymphocyte immunization therapy is an active immunomodulatory treatment that is used for couples who have unexplained repeated miscarriages, recurrent IVF failures, unexplained infertility, and in some cases of even unexplained late pregnancy losses. The underlying problem here is called as an alloimmune problem. That is, there is no protection to the pregnancy which is immunologically different from mother. Usually by default, immunologically different pregnancy is protected in the mother's body by certain type of antibodies called as protective antibodies or blocking antibodies or asymmetric antibodies, and certain type of protective cells called as T regulatory cells. And because of these mechanisms, the pregnancy grows without any problem even when it is different from the mother's body. That day there was one couple who had come to our center. They had multiple IVF failures, and their immunological investigations indicated that they will be benefited by the immunomodulatory treatment of ImmuLIT. But there was one problem. Husband was HBsAg positive or Australia antigen positive, because you know that for lymphocyte immunization therapy we have to take husband's blood, separate lymphocytes, and inject them in wife. So I explained to the couple, I told them that because the husband is HBsAg positive, we can't use his blood. So the couple was worried. They said, so doctor, we can't take this therapy. So I told them, don't worry. I will just explain to you what is the principle of lymphocyte immunization therapy, then you will realize. Because in your case, instead of your lymphocytes, we can use lymphocytes from a donor who has been tested for infections. So they were a bit surprised. They said, but doctor, it is my sperm and my wife's egg. And how can we use lymphocytes from a third person or third person donor? So then I told them, wait, I will just explain to you the principle of lymphocyte immunization therapy, and then you will immediately realize why I am saying this. Now, in lymphocyte immunization therapy, the principle is lymphocytes from any person other than the wife herself, that is, use of allogenic lymphocytes is done to induce the protective response in the form of protective antibodies and protective cells. Now, allogenic means, as I said, from any person other than any human being other than the patient herself. That is, it may be her husband, maybe any donor, any random person, any relative or non-relative, any person who has been tested for infection profile. Why we can use any lymphocytes? Because the underlying basic principle or basic mechanism how lymphocyte immunization therapy works is that whenever these allogenic lymphocytes are injected in wife, there is something called as a surface marker known as CD200, which is present on all lymphocytes. And this CD200 marker is the important substance or important antigen which induces the immunological response in wife. The cells are taken by dendritic cells to the immune system of the wife or the mother, and the T cells and B cells are stimulated, and then they later on give rise to protective antibodies and protective cells when they are exposed to pregnancy later on. So you must have understood that any lymphocyte, not necessarily from husband, can be used to induce this protective response. I'll just explain a little more in detail. Suppose, as in this couple, where the gametes that were used for IVF were self, that is from husband's sperm and wife's egg. Still, because husband was HBsAg positive, we can't use his blood. There might be other situations like certain medical disorders where we can't take husband's blood. In those cases, we can use blood from any random donor, related or not related to the person, and who has been tested for infection profile, and those cells can be used to induce the protective response. Now, there is one more situation. So there are cases where donor gametes are used. Either donor egg is used, donor sperm is used, or donor embryo is used. Now, in that case, if the couple requires lymphocyte immunization therapy, what should we do? Can we give? So here it is also important to understand that even when the gametes are donor, maybe sperm, egg, or even embryo, we can still use lymphocytes from the husband to induce the protective response if the husband's infection profile reports are normal. So, if I'm repeating this important fact that even when the gametes are self, we can use a donor lymphocytes, and if there are donor gametes, we did not go and take the lymphocytes from the person who has donated the sperm or donated the egg, but we can still use husband's lymphocytes to induce the protective response. So therefore, in lymphocyte immunization therapy, it is the allogenic lymphocyte which is important, and not necessarily only husbands or only donor. So, if we understand this small but important fact, then it will be very clear and there will be no doubts in the minds of our patients or even our doctor colleagues when they think about or when they tell patients about lymphocyte immunization therapy and their and if that is going to be useful for them, and they need not worry about using self lymphocytes or donor lymphocytes. And all of you know that lymphocyte immunization therapy is a very effective and safe treatment for couples with so-called unexplained recurrent pregnancy loss, miscarriage, IVF failures, or infertility if the immunological investigations indicate that the couple will be benefited by the treatment. So you have understood this important point, and I'm sure later on it will be extended or told to your patients. This is for my doctor colleagues, and for patients who are listening to it, they need not worry about using donor gametes, donor lymphocytes with self gametes, and vice versa. Thank you so much.